Okay. No, I don't want to stop the recording. I want it to stay. All right, here we are. Okay. Now, let's see where we are at. We just finished in chapter 14, adaptive massage, talking about working with kids, pediatrics, and now we're going to look at working with older adults. And so I can speak as an active participant in that population process these days. So, just like with the life stage, remember the stages of life that we had back when, for this population beginning their life, there are adaptations that we need to look at, normal changes that occur, and strains and stresses on the system related to aging. And of all the video sequences I have done over the years, I have really enjoyed this one. This gentleman was just a delight to work with, and very representative. And this is the same gentleman that did the big long sequence of postural assessment in chapter 11. So, so this just goes through and talks about the attention and the little bit of adaptation required. Sometimes there's a little bit more of a belly, and the person would be more comfortable working laying on their side for side lying position. Sometimes there's a generational increase in modesty, and sometimes the modesty is not as much of an issue. But we always want to be respectful. I tend not to keep older clients on their stomach for very long. I want to get them over on their side as quickly as possible. And there's additional bolstering and stuff because there might be a sore shoulder. And the range of motion may be limited some. There might need to be a level of assistance of helping the person up. There's a little bit more tendency to dizziness that can occur with a position change. But there are lots of reasons. There's more stiffness, there's more aches and pains, there's a change in soft tissue construct, there's a little bit more fat and fibrotic type tissue. Remember, connective tissues are fluid and fibers. There's a change over there. The joints can have some wear and tear to them. The inner ear issues that are common can cause a tendency to fall or be dizzy. Visual changes occur. Just trying to navigate with bifocals, and stairs. And again, because I'm living this now, and with the visual changes I've got, and a teeny little bit of hearing loss, and a persistent inner ear condition that makes me dizzy, and a knee that I tore up the ligaments in the knee years ago, and the instability around that. And I get it. Now, like 20 years ago, I didn't get it as much, but I really get it now. So, and for some, of the elderly, the older clients that we would serve, there's a level of isolation too, and the importance of connection. At the spa that we have a lot of older clients, and they are there because that is their social connection along with everything else. And they talk sometimes, not all, but there's a need to understand the whole social dynamics of connection and touch. And in our student clinic we have at the school, we've had clients come to that student clinic forever. The school is 34 years old, maybe even older. And we've had clients that have come to the student clinic for years and years. And some of them have gotten quite elderly, and they have lots of things. And there's one lady I think of in particular, and she'll, because the students have to do a complete history and do an assessment, and there's lots of stuff, lots of medication, and all that. And then they'll ask, well, what is going to be our focus for today? And she'll very sweetly look at them and say, I want you to ignore all of that stuff, and I want you to treat me nicely, and I want you to touch me, because that's what I miss the most. What a lesson there. So certainly there are adaptations. There's changes in the bone brittleness and all that kind of stuff. But we also have to really think much bigger here with this population. You need to look up medications, and Medline Plus works really good here. You need to screen for depression and dementia. One of the massage therapists at our spa clinic chatted with me that she had noticed that a client for a couple of weeks had put down the wrong date. And that was a red flag for us. It's a little bit of a mental status change, and he's in his 80s. So we're on watch for that. We chatted with him about that, and right now that has been as much as we feel the need to do. But should we notice something, we may need to get a hold of our emergency contact person and have them possibly be a little bit more diligent. The other thing that can occur in here is the ability to give informed consent. If there is mental changes and the ability to understand what's going on in the environment, they may not be able to truly give an informed consent. So you have to be much more deliberate with that if there's a change in mental status. Now that doesn't always occur. So don't think that just because somebody is older that they have diminishing mental capacity. Sometimes it does show up in short-term memory, but we are, as a population now, as of doing these videos, I'm 67. As a population, we are the fastest growing population. And so there's a lot of us, and we can probably benefit from massage, and the quality of our life will improve because of that. Now, if somebody has dementia, you can still give them a massage so long as the guardian is aware of the informed consent process. And you may find a practice setting in long-term care or in a senior center that would require you to have more a deeper understanding. Also, various infections can show themselves as a change in mental status in the elderly. and kidney infections is one. And there also can be some hallucination that goes with some of these mental changes. And many times an individual won't tell you about that because they know what they're seeing isn't real, but that's still there. So there's an underlying stress response that goes with that. And certainly we become part of the social interaction and the nurturing and the compassion, as well as helping a person get in their daily exercise and climbing the stairs and staying able to perform daily life activities to support their independence and helping with the transition. Listen to the stories. Be patient. Okay. What is our next group? Acute care. So this can be a local situation, like an acute injury, like somebody has cut themselves or burned themselves or broken a leg, taken a fall, which is common in the elderly, back and forth. We bounce a little less, we're a little less pliable. Or it can be an acute illness. And this most often would involve both of these, some sort of interface with the medical world. And chances are that unless we work in a medical setting, we're probably not going to work with this situation. That being said, we still have to understand that the process of resolving an acute situation is productive. And if we do provide care, it's palliative, and to try to support some sleep and some generalized care, discomfort, management of symptoms that are that if a person has discomfort/pain. We may find this if you are working in a hospital. That would be the most common situation that you would interact with massage in acute care. So now we go back and you would have to increase your knowledge around how to function in that type of a setting. Massage is pretty good at managing acute pain. You're not, by massaging another area. So I remember when I had the open heart surgery, I'm going to tell you now that hurt. And it hurt for quite a while. It has a big hole to heal, and it's in the chest, and every time you breathe, etc. And Luke was my caregiver during the recovery process, and he would massage my feet, and it to this day amazes me how much comfort I got during that acute resolving that acute situation from that. And so that would be how we might function in acute pain management. And I mentioned in another video the idea of M technique, but it's a very gentle massage process that can be learned for hands and forearms and lower legs and feet. The other thing that was very comforting to me was massage of the scalp, and because there's a ton of sensory information there. So that's how that would look. And then this box gives you some guidance on how you would work through this. So here's your acute phase. manage pain, support sleep. And then as that starts to revolve, it still is manage pain, usually indirectly. The general massage or massaging an area that is pleasurable with enough intensity to act like a counter irritant or hyperstimulation analgesia. Support sleep, potentially manage edema, and manage compensation patterns. So back to my heart surgery thing. They had tubes and stuff in my neck, and they intubated me, and I was sore in here. And that persisted because my breathing was so different. And so after a while, neck and shoulder massage became targeting that area became very helpful. And then as this healing progresses, then we begin to add additional focuses. I had to go to cardiac rehab as an example, and I had walked a lot, but I had used my arms. They wanted me to do almost like a bicycle with my arms. That's different. I don't use my arms like that. And so I remember getting sore in my shoulders from that. I worked on my scar myself, and it healed very well. And, just in general, managing all of this helps the healing process in general. And then later stages and ongoing care, the tissue pliability around the area, any ongoing rehab, resourceful compensation. These are areas that massage can continue to support somebody. But this is no longer acute care. Now we're getting into the condition management area. Chronic illness. This is where massage therapy has a ton to offer. And as I look at this, I want to point out this box, which is more related to the section we just finished. This is what you do for strains and sprains, and how to help create a healing process that results in a mobile scar. And then a little bit of strategy here on what to do if you've got an old scar that healed kind of thick and dense. And then also this box that is specific for pain management. So do pay attention to this. Okay, chronic illness. So this is epidemic. These can be autoimmune illnesses, it can be endocrine like diabetes, it can be cardiovascular. It's something that can be managed, but there is going to be a level of progression maybe, or good days and bad days. It can be systemic, like maybe fibromyalgia. It can be local, like arthrosis of the knee. You have to have your head on straight when you're working with chronic illness. You're not in a therapeutic change approach. Now, that being said, if you are working with somebody over an extended period of time in a retention client base like you've been taught, and there's a chronic illness process involved with the person's life, then you may find as a person is managing better that you can start to see some better function, and the person actually starts to do better. The issue here is that if anything that they are doing, including massage, dietary, exercise, sleep hygiene, mental health support, if they stop doing that, then the symptoms will likely come back. So I think we have, as an occupation, a tremendous amount to offer to people dealing with the whole spectrum of chronic conditions, and helping them have a higher quality of life. But we got to get beyond trying to fix it. And in the massage community, that fix-it mentality is often connected with professional identity and an idea of wanting to have some status. And if I fixed it, I have status, right? No. So here are your adaptations. There may or may not be medications. There is an up and down nature to chronic illnesses and conditions. A person is going to do better if they do things like moderate exercise and involvement. Hydrotherapy is great. Teaching self-help, stuff that helps them have a sense of resilience, an ability to bounce, and inclusion of an integrated approach. So pain is a common component here. So the use of opiates for pain has not gone well. And so to deal with the opiate crisis and deal with the chronic conditions that are very draining on the traditional medical community, that's where we're starting to get our overlap in our integrative approaches. And the VA is leading the way on this. They've got something called whole person care. And you may want to investigate that more, because the model they're putting forth is really good. And the Department of Defense is also involved in this. So this is your interdisciplinary world, and how you would most likely interface with other health professions as well as medical professionals. Here is what we would need to consider with the massage and the massage therapist and the client. And understanding that the goal is to feel better, move better, do better, and not to fix it. Okay, I'm going to stop this video here, and then we're going to start over again with oncology care. And this is an area where advanced training is recommended because of the complex nature of the various treatment protocols and post cancer care once the situation has been resolved or in remission. And there's an actual society that supports massage therapists in dealing and functioning resourcefully in this particular environment. Okay, so we're going to stop the share and end this video. Ta-da!